Yes.
Thank you. Andrew from AIDS Concern in Hong Kong, the NGO. Thank you for your excellent presentations. I think in addition to the different elements that you describe, I can see that in some parts of Asia that there is work on social enterprise projects which can bring additional funding into HIV. And I think this has got a lot of opportunity. So we've just started to sell HIV self-test kits in Hong Kong as an NGO. And it's actually easier for an NGO sometimes to get things done without having to deal with all sorts of other systems within huge organizations. So I just wonder if any of the panel have got knowledge about what other social enterprise projects are going on in the region that have real potential to spread.
Any experience in the region?
So when it comes to self-testing, it's quite embarrassing to discuss from the PEPFAR perspective in Asia. So Thailand is the only country implementing it, but implementing it under, but this is from the PEPFAR program, supported programs. It really was implemented under operational research in Thailand, in Laos. In Laos, we have made a lot of progress having implemented oral fluid screenings to increase access and promoting social marketing together working with OraSure company. But the government has really allowed us to implement it without research and then included it in the national guidelines that self-testing is allowed for the people of Laos. But in Thailand, we are still undergoing, if we have to do the self-testing and increasing or scaling up, we will still have to implement it under research because we are still waiting for companies to register their products, and that could take maybe until the end of this year for all the companies to succeed, while the countries or the national government, FDA has recently approved self-testing in Thailand, but yet we are unable to support implementation of that. So that's the gist of our experience in these two countries. And the rest of the countries in PEPFAR programs, there's no self-testing implemented.
Andrew, your question was about social enterprises as well, not specific. There are a number of countries, particularly, or rather, number of NGOs or organizations in some countries, like in India in particular, there are a number there. Humsafar is a good example where they're doing a mix of social enterprise, self-generation, because I think your point's very valid, and I should have stressed that in the beginning. We want to make sure that the community programs are sustained during transition, and we know we see a contraction and a reduction in the number of them, but that's partly also you can't be totally reliant on government funding. Or, as we've seen, if you're reliant on Global Fund, because Global Fund doesn't fund the advocacy part of what a lot of community groups do either. So you become a service implementer, and that's very narrow. So self-funding for parts of the work is really important. So Humsafar is a good example. Malaysia Class is another one that's looking at similar models. So there are a few around that are moving that way, or they're broadening out from just HIV and picking up other health areas, which is another good logic, because the strength of adherence support for HIV treatment is equally relevant to TB and hasn't been maximised or utilised enough. And so you see some donors close down funding for adherence support, like in PNG, for HIV, and then they're trying to create a new cadre of people to do treatment support for TB. It's kind of illogical. So the service providers community could be doing that across. So there are a couple of examples, but there are others in other places. But the scale of what I know you're doing is different, and commodities like self-testing are a new one that can be done that way. But the co-financing of PrEP is another issue that some of the community groups will be taking on as well as part of it. But increasingly, they need to be looking at how they can be doing dual financing, if you like, or multiple sources.
I'm not. I'm not sure if, okay. Yeah, no, just related to that. Also, we realize that, not realize, we know that a lot of the people, I mean, for example, commodities such as the self-testings and also maybe PrEP, the people are really procuring, accessing through the internet or the web management. And it's really happening. And then sometimes people feel that's much easier. And then I think that still we need to perhaps work a little bit more to how we can make it better in terms, for example, the linking then finally to the service providers, and once you got the self-testing kits from the internet, and how do we support them? And so perhaps maybe we need to work a little bit more on that issue because it's already ongoing and it's happening, and so what the needs there and how we can do that.
Yeah, so to add a little bit more on that, from Thailand perspective, I think that the concept of social enterprise is what our CBOs working with key populations are also interested in exploring. However, for us, since we have been working towards having CBOs staff being certified, having CBO clinics being accredited, and then having the government direct funding coming to the CBOs for services provided, it has been quite sensitive in the country when we talk about social enterprise and then how government will define the service delivery unit, which is a CBO, getting or gaining income, being a service delivery unit that the government could directly fund them. So we have been quite careful about that. However, beyond that, I think it is certainly a way to go. And we, after having this system settled in the next few months or year, will certainly be exploring that and especially bringing all that self-testing and PrEP and PEP in the gray market up to over the table, and then make it be going through the channels that we know will reach those who are in greatest need of it.
Any other comments? Yes, Jeremy.
Hi, Jeremy from Treat Asia, based in Bangkok. I have a couple of questions. The first one relates to the title of the session. So the session title was Transition to Domestic and Regional Funding. So I'm just wondering, and this is addressed not to any panel member in particular, but what are the real prospects for regional funding sources for HIV-related programming? And my second question is that we heard, or my second point, I guess, is that we heard from panel members very eloquently around the needs for additional domestic funding, around what we might do if some of that domestic funding was secured. But we heard very little on the big macro issue, which is, how successful have we been in terms of securing domestic funding from regional governments? Naoko presented a couple of examples in Malaysia and Vietnam, but on the broad macro level, amongst the governments that are in the region, how successful have we been in advocating for increased domestic financing, not just of HIV, but of health in general?
Anyone? Yes. Yes.
Okay, thanks. There were some slides, and maybe we didn't focus enough on that, where we do have significant increase in domestic financing when we're talking HIV. Broader health, I put Naoko on the spot. But as I was explaining, it's where are they investing, right, was the issue. So we have 75% is domestically financed. There's still a big gap above that, but of the current funding, 75% is domestic across the region. A couple of big countries push that up, and so like your Thailand's, Malaysia, China, where they're almost 100% self-funded, that pushes that regional average up, right? So that's the reality compared to a Laos or a Pakistan with a massive epidemic, but it's not investing its own resources. Even 2 weeks ago I was there, and they have an outbreak of 700 children through infection control problems being infected in just one state, and they're looking for donors to help, right? And it's the wealthiest state in the country. So we certainly have a long way to go to advocate, and that, for me, is the biggest concern. As we transition to domestic financing, it's going to be certain components of the current program of HIV, or you're going to see a reduction in the finances in reality in some countries because they're not going to prioritise HIV over other programs. Regional funds, yes, I had noticed that in the title, but there are not regional funds being set up, so I don't see that we're going to see some kind of regional ADB or other bank institution putting up a regional fund, because the funds are principally talked about as donor mechanisms. What we might start seeing is some of the procurement, pooled procurement, which is something that a number of countries are starting to talk about. How do you get those prices down? And some countries, it's very small scale. So if the Global Fund, who does their pooled procurement for them now, pulls out, the costs could go up. And then that's one of the challenges, and that's why I use Cambodia as an example, where they've got too much of the Rolls-Royce. Can they afford their own program, which is largely designed by donors? And we saw that in India too, with the Avahan program, which was Gates funded. It was fantastic, but not transferable. So that's the other aspect of that. But there's no regional funds that I'm aware of.
Yeah, just to add to Eamonn, yes, I was also realizing this, the regional funding and regional HIV funding, we do not really have anything very specific or anything new. But at the same time, what we are trying to look at is the other related funds, the available resources at the regional level to complement or to also to contribute to the HIV response. For example, like in our regions, now lots of, not a lot, but it's the quite substantial amount of the funding is given to the antimicrobial resistance related work. And also the sum from the World Bank or for the ADB, Asian Development Bank, for the health system strengthening. So those funds, sometimes we try to maximize to strengthen some of our HIV-related response in the country. For example, health information systems, or maybe the procurement systems, or a little bit wider health workforce development. So there might be some opportunities, but it's not perhaps specifically for HIV, but linking into some of the related programs or the agendas.
That's the horizontal nature.
Yeah.
I have a question.
Yes.
This is really a question for anyone on the panel, perhaps all three of you, but I'm sort of picking up on other people's comments that clearly there are some examples of countries, perhaps some of them are sort of more in the highish middle income bracket, where there is reasonable prospects. I'm thinking of Thailand, China, Malaysia, where domestic resources can be transferred in order to make up the shortfall, right, from the withdrawal of the major donors. But there were clearly other countries, perhaps, in lower middle income and low income even, actually lower middle income, I think probably all of them, other than perhaps Cambodia, where it looked as though the data suggested that there would just be too much of a shortfall and they're likely to not be able to sustain programs as currently constituted. I'm just wondering with the donors, I mean, it seemed like that's kind of almost off the table. They're going and they've got a timetable, it seemed, although it wasn't stated, to withdraw. Is there any kind of thinking about safety mechanisms or ways in which the donors might extend the timeline and negotiate with government to try and avoid some of the strategies like going into reverse, and potentially, particularly in a place like the Philippines, which is having this explosive epidemic, so that we don't see a loss of the gains that have been made over the last couple of decades?
The Philippines is not an issue of financing. The government, the health service in the Philippines returns AIDS money every year to consolidated revenue. So that's not a problem of lack of domestic resources. It's not having the right policies in place, the right programs in place, and the process to develop. If you're talking about PrEP with an emergency epidemic there amongst young men who have sex with men and under 24 and as young as 13 coming in with late-stage illness, and they're talking about guideline processes, right? right? So it's about the complacency factor, I would hazard there, and putting processes in the way of good practice. And so that's still a big challenge. So without picking on them in particular. But the other issue I think that comes with that is that the prioritization and the challenge for the donors, and we've seen some donors, I shouldn't name them, of course, we won't get them back, but who just close down, right? And they don't give, even a month's notice, and then the programs are meant to be self-fulfilling, or the government's meant to pick it up. But the challenge from the donor side is, if you don't actually make it serious, and I worked in Vietnam for many years, and so we saw that with the PEPFAR program. Yep. If the donor puts the money into treatment, it's hard to pull out. So how do you get that transition to happen? And transition should happen. If we've got the economic growth of Asia, governments need to pick up more and more of the costs. But so this is the challenge for a donor. But the planning is often not done well, and there should be targets set to show that there will be transition in the areas we know governments historically do not fund well. And that's the social enterprise part, the community part, the engagement areas, prevention, as part of continuing the funding. Right? But then this is where it gets very difficult for a donor. But then the transition plans are often not done because the government has the money, they should pick it up. But we saw from some of the slides, areas of health are being invested in by governments, but not all areas, particularly some of the areas that we're most interested, not just HIV, hepatitis is another example. So, and the pressure there is, if a donor's still there, they will put their resources elsewhere, or in some cases, they don't really see the people affected by HIV as a priority community group.
Thank you.
Yeah, I mean, it was very comprehensive answer already, and I think Eamonn has sat in some of the meetings led by PEPFAR when it comes to determining financial resources to countries. It's really about the situations, the epidemics that countries need to be committed to responding to or addressing those, and then about the balance between being serious about ensuring that commitment, if it's not coming from the government, so why bother? Why the external donors, such as the U.S. government, bothers giving or continuing to give more money to the governments when they are not serious about addressing their own issues? So that's inevitable scenario. But in many cases, I'm not speaking on behalf of PEPFAR, but what I've seen sitting there being from USAID is that while the hard decision needs to be made, and the reason why we said, all of us said that transitioning or increasing domestic financing needs to be planned early, needs to be done soon enough, because we don't know when that balance is not managed in your favor. Because there are lots of issues that we cannot manage, such as the government commitment, such as the emerging epidemics in those countries and things like that. And then those who will be most impacted will be those who have the least power in the communities, and those are your patients and people in the communities dealing with HIV. So we've seen those the countries like such as Laos being put in a different category, and then some provinces will have to phase out from the HIV support from PEPFAR, for example, and that they're facing a lot of consequences, serious consequences in that change of policy. So just, again, be prepared and prepared early. But one thing that I would like to make is that when Eamonn talks about balance and being serious, there's an issue with donors being in harmony in terms of saying that countries need to transition. We've seen some countries that when transition is mentioned by international donors, and countries took it very seriously and starting to put in place mechanisms and processes to ensure that they have sustainable financing for the HIV response. And then when that has become less serious, or if someone's, let's say, a global fund, change course that, countries do not have to transition anymore. And that's changed the whole game in the country. So people are not, or government officials are not serious about it anymore. And they're not serious about the urgency of putting in place the finances, or adequate finances for civil society organizations. So that's something that I think we all need to work together to ensure that what we're saying here, early planning, early preparation needs to take place. And we need to take whole people who are in the important positions accountable for this. Thank you.
Just very two quick points, and I totally agree with both of the speakers, and then I think this transition is really country very specific and by context, and then at the same time I think we really need to look at the other programs. For example, like the donors requesting the country to prepare for transition from HIV side, but at the same time immunization programs, they are requested by Gavi to also transit. And so actually they have a double or triple burden at the same time. So I think the donors also, we need to really work, I'm not the donor, but the donor has to also have a good communication of what's happening in totality for the countries, not only from the specific, from each programs. And another issue is that, for example, Cambodia, as I think you may see in the Eamonn slides, that they are really successful, but I think they're largely funded by external funding. But because they did so well, the donors are really withdrawing. And so we see this is really critical. It's really the problems for coming years. So I think the transition is not so simple, and then I think we also need a kind of advocacy to maybe sustain or a little bit slow the progress, and depending on the country, to have really the smooth transitions, not to make any the problems in the futures.
Thank you very much. I think this has been a very interesting session, and I hope that for those of you who may be very new to this transition wording, I believe many of you are here, would by the end of this session understand more, feel that it is also your responsibilities to talk about transition more seriously, or think about this more seriously in your own country, because it's not only taking a clinician or one person to end HIV in your country, but it's a combination of multi-stakeholders that has brought us to today's success in HIV. So I thank you all. Thank you all the speakers here, and also thank everyone for attending.